Well, hi folks. Nice to be able to take a few minutes just to chat with you briefly. I'm sure we're all adjusting to level two, both personally and organisation. I still haven't managed to get a haircut, though you may not have noticed that. It's pretty hard to tell. But I'm sure, like you, you're enjoying catching up with workmates as they're returning to the office, even if that's only to be there for a couple of days and continuing to do a mix of working from home or working from the office. For those of you at the clinical coalface, I'm sure you're still very aware of the need to do all the right things in terms of keeping our patient staff and keeping yourselves safe in terms of good PPE, good public health basic measures. And the reality is this is the new normal. We're just going to have to get smart as an organisation about staying vigilant and being careful. Some things are going to take a bit longer, but actually we'll settle into that new way of working. I just finished preparing the reports that I have to provide to the board each month, and I was saying to my team just how, in a sense, almost overwhelmed, but how amazed I was at the phenomenal energy effort that's gone into the health system over the last 7 or 8 weeks. Boy, people have done an amazing job, and so a huge thank you again. But perhaps the most stunning thing was how much change and how much innovation and how much wonderful teamwork was happening over the last 7 or 8 weeks. And while it probably was pretty exhausting, one of the things we're really keen to do is not lose all of that energy, ideas, innovation. And some of those things that you've started doing, we must learn how to embed. Some things we need to roll back because we don't need that extra resource, but we certainly need to keep exploring different ways of delivering great care for our community. So congratulations to all of you across our health system, for instance, that really got stuck in on virtual healthcare, because I know for many of our patients that was a great experience. It meant the continuity of care being delivered, and actually we probably saved heaps of time for lots of people and ensured that our care was more responsive. So thank you. Let's reflect, let's pause and reflect and figure out how we continue to do that in a way that's safe and appropriate. I know as an organisation we're just trying to figure out how this new normal looks, so please be patient with us as we think about how now we need to organise ourselves so we look after staff, we keep them safe, but actually we need some new guidelines, particularly if more of us are going to work from home or our teams find it more difficult to come together in the same room. I know I'm still doing lots of Zoom meetings, I'm sure you are, but we just we'll get some guidelines together and share those with you to try and support you and help you to do the best job you can and for your team to work the best it can going forward. I'll chat to you next week. Email is always open. If you've got ideas or suggestions, flick them through to me. And if there are issues that we're not getting to as an organisation that you think we need to give consideration to, please don't hesitate to let me know. Huge thank you again. Take care of yourselves, and let's keep learning and innovating together over these next weeks. Anyway, take care.